Gentlemen, what if I told you that a simple gel, yes, just a gel applied directly to the penis, could help you achieve an erection in as little as 10 minutes? No prescription, no pharmacy awkwardness. Sounds almost too good to be true, doesn't it? Well, today I'm going to talk about a brand new FDA-authorized topical gel for erectile dysfunction called Aroxen. And I want to be completely honest with you from the very first second. This is not magic, and it is absolutely not for everyone. I'm Dr. Lila Romano, a board-certified urologist with over a decade of experience helping men reclaim their confidence, their vitality, and yes, their sexual health. My job today is to separate the scientific fact from the marketing hype. I'm going to explain exactly what this gel is, how it works inside your body, how effective it truly is, and most importantly, who should use it and who should not. Stay with me, because later in this video, I'm going to give you a simple one-question test that will tell you immediately whether this gel is likely to work for you, or whether your body needs something different entirely. And I'll walk you through the exact 15-second application technique that determines whether this gel changes your life or sits in a drawer doing absolutely nothing. Don't skip ahead. You need all of this. But before we even get into the gel itself, I need you to understand something important, something that too many men, and honestly, too many doctors, still get wrong. Erectile dysfunction is not just a plumbing problem. It never has been. For years, men have been sold this oversimplified idea that ED is purely mechanical. Take a pill, fix the pipe, problem solved. But the truth is far more complex than that, and far more meaningful. A healthy erection is actually the result of a beautifully coordinated symphony involving your brain, your nervous system, your hormones, your emotions, and yes, your blood vessels. Every single one of those systems has to be working together, in harmony, at exactly the right moment. When even one instrument falls out of tune, whether it's elevated stress hormones, blood pressure issues, nerve changes from aging, or declining testosterone, performance suffers. And here's something I tell every single patient who walks into my clinic. Erectile dysfunction is often one of the earliest warning signals your cardiovascular system sends you. Think of it like the canary in the coal mine. When blood vessels in the penis, which are among the smallest in the entire body, begin to lose their ability to dilate on demand, that's often a sign that similar changes are happening elsewhere, in your heart, in your arteries. It's your body whispering to you that something needs attention. Now add to that the frustrations that come with the current solutions. Oral medications like Viagra and Cialis do work for many men, but they come with real drawbacks. You have to take them 30 to 60 minutes before intimacy. That means planning, watching the clock, killing the spontaneity of the moment. And for some men, the side effects are genuinely unbearable. Pounding headaches, facial, flushing, nasal congestion, and in rare cases, vision disturbances. And for men who are already taking nitrate medications for heart conditions, Viagra and Cialis are simply off the table, completely contraindicated. Those men have had virtually no safe pharmaceutical option for ED. Until now. I've sat across from thousands of men in my clinic, men in their 50s, 60s, and beyond, who are quietly struggling with this, but don't feel comfortable bringing it up, even to their own doctor. So I want you to think of this video as your private consultation. We are going to talk openly, honestly, and without judgment, because you deserve real answers. So, when a brand new FDA-authorized topical gel came onto the market with the promise of faster results and fewer side effects, I did what any good urologist would do. I went straight to the clinical data, and what I found is genuinely worth your attention. Here is what we know. Erection is an FDA-authorized, over-the-counter topical gel for erectile dysfunction. No prescription required. You can order it online or find it at select pharmacies. And the mechanism by which it works is completely different from any pill you've ever taken, which is exactly why it's generating so much discussion in the urology community right now. So what exactly is Aroxen, and how do you use it? Practically speaking, it's a topical gel that comes in a small single-use tube, one tube per encounter. You apply the entire contents directly to the glands. That's the head of the penis, and you rub it in gently for about 15 seconds. That's it, simple in concept. But what happens next inside your body is genuinely fascinating. Within moments of application, you'll notice something unexpected, a rapid cooling sensation on the skin. Then, over the next minute or two, that cooling gradually gives way to a gentle warmth. Now, here's where most men think this is just some kind of tingly gimmick. It is not. That temperature shift is the mechanism. That cooling to warming effect directly stimulates the sensitive nerve endings in the glands, which happen to be among the most densely packed nerve endings in the entire male body. That stimulation sends a rapid signal up through your nervous system to your brain, and your brain, receiving that signal, responds by triggering the local release of a molecule called nitric oxide. Now, if you've watched any of my previous videos, you've heard me talk about nitric oxide before. But for anyone who's new, let me explain it simply. Nitric oxide is the chemical spark that initiates an erection. It's the molecule that tells the smooth muscle tissue inside the penis to relax, allowing blood to rush in, fill the erectile chambers, and create firmness. Think of it as your body's own built-in on switch. Nitric oxide flips it. Here's what makes Aroxen fundamentally different from pills like Viagra or Cialis, and this distinction is critical to understand. Those oral medications work from the inside out. You swallow a pill, it enters your bloodstream, it circulates through your entire body, and it inhibits an enzyme called PDE5 systemically. That's why you get the headaches, the flushing, the blood pressure changes. The drug is affecting far more than just the blood vessels in your penis. Aroxen works from the outside in. It stays local. It stimulates the nerves at the surface. Those nerves trigger nitric oxide release in exactly the tissue where you need it. And the response is targeted. Your bloodstream isn't flooded. Your entire cardiovascular system isn't altered. The effect is precisely where it needs to be. Now, and this is important, Aroxen will not give you an erection by itself. You still need arousal. The gel primes the system, it lowers the threshold, it makes your body far more responsive to the signals it's already receiving. But you and your partner and your own desire still provide the fuel. And from a biological standpoint, that is actually a very good thing. It means this gel is working with your body's natural processes, amplifying them rather than overriding them with a chemical sledgehammer. Now we get to the part that matters most, the clinical evidence. Does it actually work? Let's look at the data. In 2023, the European Society for Sexual Medicine presented results from a significant clinical trial directly comparing Aroxen with tadalafil, the generic name for Cialis. The study enrolled over 100 men with varying degrees of erectile dysfunction. Here's what they found. 61% of the men using Aroxen reported a clinically meaningful improvement in erectile function. For tadalafil, that number was 87%. Now, before you jump to conclusions, I need you to understand how to read that comparison correctly. Because on the surface, it might look like Aroxen lost. It didn't. Aroxen works. A 61% meaningful response rate in a pharmaceutical trial is genuinely impressive. The more important question is, what are you trading for that 26 percentage point difference? And the answer to that question changes everything. But let's look at a second study because one trial is never enough. The FM57 trial enrolled over 1,000 men across 60 different clinics, a much larger, much more rigorous dataset. One challenge with any ED study is the placebo effect, which in this particular area of medicine can be as high as 40%. Men feel more confident because they believe they've taken something effective. Even accounting for that, Aroxen came out significantly ahead. And the headline finding from FM57? Approximately 60% of men achieved a satisfactory erection within 10 minutes of applying the gel. 10 minutes. Compare that to Viagra, which typically requires 30 to 60 minutes to reach peak effectiveness, or Cialis, which needs at least 30 minutes. That speed advantage is not trivial. It is genuinely life-changing for a couple's intimacy. No more planning. No more sitting on opposite ends of the couch watching the clock. No more breaking the mood. To wait for a pill to kick in, 10 minutes is within the natural rhythm of intimacy. Now let's talk about side effects, because this is where the data becomes very compelling for men over 50. In the clinical trials, only 4% of men using Aroxen reported any side effects, and those were mild, occasional headache or slight nausea. Compare that to nearly 20% of men reporting side effects with tadalafil. Because Aroxen acts locally, you simply don't get the systemic reactions. No flushed face, no pounding headaches, no sudden blood pressure drops, no vision changes. And then there is what I consider the single most significant advantage of this gel. And frankly, the finding that genuinely stopped me when I first read it. Aroxen is compatible with nitrate medications. Let me explain why that is such a big deal. Nitrates are a class of drugs prescribed to men with coronary artery disease, drugs like nitroglycerin. These men need their heart medication, but oral ED medications like Viagra and Cialis are strictly contraindicated with nitrates because the combination can cause a sudden, dangerous drop in blood pressure. For years, decades, men on heart medications have simply had no safe pharmaceutical option for erectile dysfunction. They were told, essentially, that this part of their life was over. Aroxen changes that. Because it works locally and does not enter the bloodstream in significant concentrations, the dangerous interaction does not occur. This opens a door that has been completely closed for millions of men. I want every man watching this who is on heart medication to hear that clearly. Two more practical points worth knowing. Aroxen is safe to use with latex condoms. It does not degrade or compromise them, and it is safe during oral intimacy. It poses no harm to a partner. Correct application removes any transfer concerns. But I need to be honest about something that the headlines won't tell you. Roughly 40% of men in the trials did not get a meaningful response. And I want to address that directly, because I never, ever want a man to try this gel, not respond, and walk away thinking he is broken or that nothing will ever work for him. That is simply not true. What it means is that something deeper may need to be evaluated. And understanding exactly why some men respond and others don't, that is precisely what the next section is about. In my practice, before I ever recommend Erections to a patient, I ask him one question. Just one. And the answer tells me almost everything I need to know about whether this gel will work for him. Here it is. Do you still experience morning erections or even partial erections during masturbation? That's it. One question. But the answer carries enormous diagnostic weight. If your answer is yes, even occasionally, even partially, then your nerve pathways are still intact. The communication line from your brain to your penis is still open and firing. What that means is that your body already knows how to do this. It just needs the right trigger, the right amplification. Aroxen can provide exactly that. The gel stimulates those nerve endings, boosts the nitric oxide response, and helps your body complete a process it's still capable of initiating. You are a strong candidate. But if your answer is no, if you genuinely have not experienced any form of erection, morning or otherwise, in months or even years, then the situation is different. That is not a signal to give up. It's a signal to dig deeper. It likely means that either the nerve pathways have been significantly compromised, often from long-standing diabetes or vascular disease, or that the blood vessels themselves are too damaged for a topical gel to overcome on its own. In that case, a topical stimulant simply cannot do what oral medications, injections, or other interventions might. What you need is a proper medical workup, blood work, a cardiovascular assessment, and a conversation with a urologist about what your specific situation requires. So let me give you a clear picture of who Aroxen is right for and who it likely isn't. This gel is an excellent option if you have mild to moderate erectile dysfunction and still have some baseline function. It's ideal if you want a fast-acting, on-demand solution rather than a daily pill. It is particularly well-suited for men who cannot safely take oral ED medications because of heart conditions or nitrate medications. This may honestly be the best option currently available to you. And it's worth considering if you've tried pills and found the side effects simply too uncomfortable to tolerate. On the other hand, Erection is likely not the right fit if your ED stems from advanced vascular disease or severe diabetic nerve damage. It's not going to fix ED that is hormonal in origin. If your testosterone is significantly low, that needs to be addressed directly, not masked. It won't resolve ED that is primarily psychological in nature, that requires a different kind of support, and anyone with sensitive skin, known skin allergies, or any broken or irritated skin in the application area should not use it. If you experience significant burning, rash, or swelling at any point, stop use immediately and consult your doctor. Now we come to the section I promised you at the very beginning, and I want you to pay close attention here because this is where a significant portion of men go wrong, and it's the difference between wasting your money and having a completely different experience. In the clinical trials, roughly 1 in 3 men did not get a meaningful response to Aroxen. And when researchers began examining why, one factor came up repeatedly: incorrect application. Not the gel itself, not their biology, the technique. Here's the analogy I use with my patients. The gel is the fuel. The 15-second massage is the spark. Without the spark, without the friction from your fingers stimulating those nerve endings, the fuel just sits there. There is no signal sent to the brain, no nitric oxide released, and no erection. The temperature shift that drives the entire mechanism doesn't happen from the gel alone. It happens from the combination of the gel and the physical stimulation together. So let me walk you through the exact technique, step by step. First, use the entire contents of the single-use tube. Do not use half and save the rest. Each tube is designed as a single-use dose. Using less than the full amount reduces both the temperature effect and the coverage of the nerve endings. Second, apply directly to the glands, the head of the penis only. This is where the nerve density is highest and where the mechanism is most effective. Third, and this is the critical step, rub the gel in gently but with consistent pressure for a full 15 seconds. Set a timer on your phone if you need to. I'm serious. Most men who don't respond rubbed it in for 3 or 4 seconds and moved on. 15 seconds of continuous friction is what activates the nerves. Do not rush this step. Fourth, wait for the sensations. You should feel the cooling sensation begin within about 30 seconds. That tells you the nerve endings are responding. The warming sensation follows over the next 1 to 2 minutes. That is the nitric oxide releasing and the blood vessels beginning to dilate. Give your body 5 to 10 minutes after that before engaging with your partner. I had a patient, a man in his late 50s, who came back to me frustrated after his first attempt. He said it did absolutely nothing. When I asked him to walk me through his application, I quickly understood the problem. He had applied about half the tube, rubbed it in for a few seconds, and then, his words, wiped off the excess. He removed the very thing that was supposed to work. On his second attempt, using the full tube, 15 full seconds of massage and waiting for the sensations, the experience was completely different. The gel hadn't changed. His technique had. That is the difference I am asking you not to overlook. Now, I wouldn't be doing my job as your doctor if I didn't take a moment to give you the full picture, because a gel, no matter how effective, is not a complete answer. And I want to be very direct with you about this. Aroxen manages a symptom. Your lifestyle manages the cause. And I am begging you, please do not stop at the symptom. Remember what I told you at the very beginning of this video. Erectile dysfunction is often the earliest warning sign your cardiovascular system sends you. When this gel helps you perform, that is wonderful, genuinely. But it does not fix the blood vessels that are slowly declining. It does not lower your blood pressure, reduce your inflammation, or balance your hormones. It gives you a tool for tonight. What builds your health for the next decade is what you do every other hour of the day. So here is what I recommend to every patient alongside any ED treatment. A heart-healthy diet that supports endothelial function, the health of the inner lining of your blood vessels, is foundational. Foods rich in nitric oxide precursors, antioxidants, and healthy fats make a measurable difference. Regular aerobic exercise, even 40 minutes of brisk walking 4 times a week, has been shown in a 2023 meta-analysis published in the Journal of Sexual Medicine to produce erectile function improvements comparable to medication in some men. And pelvic floor exercises, Kegels, strengthen the muscles that physically trap blood in the penis during an erection. Don't underestimate them. Stress management is equally critical because chronically elevated cortisol actively suppresses testosterone and impairs the very nitric oxide pathway that Aroxen depends on. And sleep, please protect your sleep. Testosterone production peaks during the first 3 hours of deep sleep. Poor sleep is one of the most underestimated contributors to erectile dysfunction in men over 50. If this gel does not work for you, I am asking you not to give up. Come see a urologist, not just your general practitioner. Get your testosterone checked, your blood pressure evaluated, your cardiovascular health assessed. There is almost always a path forward. I have watched men in their 70s and their 80s rediscover intimacy after years of silence, not because of a miracle, but because they finally found the right combination of tools and gave their bodies what they actually needed. And as for what to expect if you do try Aroxen, give yourself a fair trial. Your first 1 or 2 attempts may be spent simply learning your body's response and perfecting your technique. By the end of 2 weeks, most men who are going to respond have a clear sense of whether it is working. Give it 30 days of consistent use before making any final judgment. And combine it with the lifestyle foundation I just described, because the two together are dramatically more powerful than either one alone. So gentlemen, I want to hear from you. In the comments below, drop pill or gel. Tell me which you would prefer, and tell me if you've already tried Aroxen or are considering it. If this video gave you real useful information, please hit that subscribe button. This is Dr. Lila Romano, and I'll see you in the next video.